Welcome to the Sales Prospector Show, supported by Lease, a sales rep and Inc. 5000 company, helping our clients grow sales by securing guaranteed appointments, qualified leads, and guaranteed contracts for their services and products across the U.S. I'm your host, Gil Pagan. You can also find us at leaseasalesrep.com and all the major social media channels. If you like this podcast, please do us a favor and 5-star it, share it with your network. We obviously interview people, CEOs, journalists, and we talk about a lot of different topics. We'd love to have you listening in on our show. Today, I have the pleasure of interviewing Yenvy Truong, and she is the CEO and co-founder of HealthSnap. Think about snapping your fingers, HealthSnap, a lifestyle management platform. Which is an all-in-one solution that removes the burden of evaluating and interpreting a patient's lifestyle health, so the provider can spend less time, the provider is a doctor or the nurse practitioner, spend less time making sense of lifestyle data and more time guiding their patients to optimal health. HealthSnap, again with the snapping, provides health data management and analytics to help providers overcome the barriers to practicing effective lifestyle medicine so they can scale prevention in their practices. All of this is made possible with the HealthSnap patient monitoring and tracking software. For those of you listening, think about Fitbit, Apple Watches, think about that kind of stuff, the wearables that people have on their bodies throughout the course of the day. All that data is collected and they make sense of it so that the provider, your doctor, middle-level provider can do something with it, create some actionable intelligence to get you better and healthier. We're going to talk about HealthSnap and what they do and how they can help practices and you and your health. But I want to talk to Yenvy first and kind of share. Yenvy, can you share? Welcome to the show, by the way. Welcome. Share a little bit about how you got into HealthSnap and how you landed in the healthcare field. Talk a little bit about that.
I always had an interest, and I think it's more driven by my culture, my parents who wanted me to be a doctor as a child. So I was always pre-med in science, but I had this fear of blood. So that was not possible for me. So in college, I started studying biomedical engineering, which was somewhat of a tangent from healthcare and with pre-med. But afterwards, I said, this is not for me. I can't be a doctor. It's just not for me. But throughout college and meeting people and throughout my life, people said, you should go work for a pharmaceutical company. You have a great personality. You would be a great salesperson in in medical sales and whatnot. And so, after college, I became a chemist, was a researcher for a little bit, and that was not me either because I had that personality that I love to talk and have fun with people. But then, it hit me, and I became a salesperson. I got my first job as a cold caller, inside sales rep for a healthcare company, a laboratory that did food sensitivity testing, and I hit the ground running. I taught myself how to make cold calls, how to talk to doctors, how to leave voice messages and that kind of thing. And then I realized, hey, this is my niche. I just hit the ground, I got the traction, and it just worked out. And so the healthcare just kind of evolved from there into various aspects of diagnostics, anti-aging, EMR platforms, various areas of healthcare.
Wow, that's cool. Many founders who, in my experience, that we work in a couple of industries, but many founders who are technology company founders typically don't have the kind of healthcare, or don't have the sales and marketing background. They're mostly, geeks for the most part, right? They write code, right? They like to see that code coming across a black screen or a blue screen, or drag and drop and develop the software, but then they really can't sell it. So I guess your background coming into the business is good because obviously you've done that kind of sales and marketing and cold calling and things like that, right? And kind of migrated into healthcare because of the influence of your parents, right?
Yeah.
when people asked me about my healthcare background and when I ran hospitals and clinics and stuff like that, they say they want to go into medicine, they want to go into become a nurse because nurses in theory were making good money. First thing I ask is that can you sit in the ER and watch blood go all over the place?
Right.
Can you stitch people up? And then they start thinking about it. No, I don't like that. Well, you don't want to be a nurse. So, that ends that conversation. So your background clearly kind of where you started, pre-med, and, kind of getting into health, and now you end up in a technology space.
Exactly.
Interestingly enough, you're in an interesting industry where healthcare clearly is growing. It's on our radar. It's in the news, every couple of weeks with the healthcare plans and Affordable Care Act and tracking outcomes or lack thereof of the how much we're spending on healthcare compared to other industrialized countries. I mean, so it's in the news relatively most of the time throughout the course of a 30-day period. Right. So, and you're with HealthSnap. It's an interesting business, clearly, where you're trying to integrate data of people's lifestyles, right? How they, what they do and the exercise, their eating habits, all these kind of things into a usable form for the medical provider. So tell us about the business and how long it's been around, and tell us about how it works with the EMRs and stuff like that, and I'll clearly jump in and ask questions because I love this kind of stuff. Go ahead.
Great. So I met my co-founder, Dr. Wesley Smith. He is a professor at the University of Miami. He teaches exercise physiology and nutrition at the University of Miami. I was introduced to him, and at the time, I've always been very much into fitness, exercise, sports, athletics. And so staying healthy and preventative care has been a passion of mine just for myself. And there was this, at the time, I did this one measurement at the gym called a VO2 max measurement, which is measuring your oxygen efficiency level. And that's highly correlated to lifespan. And so I run half marathons. And so knowing that information, knowing how you utilize oxygen is extremely important, and it's not utilized in daily healthcare. And so when I met Dr. Smith, I found out that he had developed this algorithm and this way of measuring VO2 max, for example, without any exercise. Normally you're on a treadmill, you're strapped on a mask, and you're exercising until you're completely exhausted and fall off the treadmill, basically. He showed me a way of doing this calculation without any exercise, and this was something that he was doing research at the University of Miami with. And I experienced it. I had this assessment done, and it was in like a snap where he took some measurements, some questions, and he was able to give me this lifestyle report explaining my nutritional risk, my cardiovascular, metabolic, and then also my VO2 max. So that hooked me right away. And being in healthcare for about 15 years, I said, doctors really need this right now. There's a lack of understanding what all this data is. And because of the chronic disease state in the country, we can't cure diabetes and heart disease, a lifestyle disease, with a pill. A lot of these can be reversed, and right now it's not really happening because doctors aren't really having those type of conversations with their patients. So how do we educate the physicians and the industry on this type of information and giving them insights that normally they've never probably had, even was aware that all you needed to know was a certain metric or a certain data point to reverse some of these diseases. So as soon as I met Dr. Smith, we started discussing how we could bring this to market and commercialize it. And because he was doing this research at the University of Miami, he researched about 3,000 individuals, and it was being used at the University of Miami in their wellness programs and with their athletics, professional athletes, university athletes. And so we had this huge data set of validity of the measurements and algorithms. And then so the university said, you know what, this was developed at so let's partner up. So the three of us, we started HealthSnap. We partnered up with the University of Miami. They're shareholders in our company, and we rolled out the company in 2015. previous to that, Dr. Smith did about 3 years of research on this platform, on the algorithms from 2012 to 2015, and used it as a tool to also teach his patients, who many of them, about 60% of his class, went to medical school. So that was very invigorating in a sense where these students are going into medical school, learning about lifestyle and taking a direction in healthcare with lifestyle medicine as well. So there's a lot of contributions into healthcare, both from educating the medical students within the university setting itself, and then also creating a business that's allowing us to educate healthcare providers and various other partnerships that we have in lifestyle data as well.
So I guess going back a little bit, a lot of information there, so I'm trying to dissect some of it. Going back when you first started, Dr. Smith, right? So he's teaching. He's a teacher, I guess, right, at the university.
Right? Yeah, professor.
Okay, at the university. Okay, and University of Miami in the undergraduate program. Is that
graduate and undergrad? Yes.
Graduate and undergrad, yeah, because typically people going to be pre-med, right? They go into undergrad, then they go to medical school, right? So he was coming up with this working on this platform, this technology, and you had some oxygen kind of test, and that tested your oxygen levels in your blood and all that. Is that different than a stress test when you guys were formulating this kind of platform? Is it different than that?
Doctors still use stress tests because that's a way of billing insurance, for example, but we use this estimator as a way to decide if the doctors could go into other ways of measurements. For example, blood work. If we're doing our measurements through our platform, the patient may not have any high risk, so therefore you don't have to go thoroughly into blood work and laboratory blood work unless there's something very specific that the doctor is investigating. But as it relates to just cardiovascular risk or metabolic risk, if we come back and we say, yeah, your lifestyle is indicating that you have a high risk for cardiovascular disease, the doctor then goes and does the blood work and to say, okay, you do have high cholesterol or high hemoglobin A1C contributing to diabetes, for example.
So take us through a little bit about, to understand how the technology works, and take us through that process of it, where you get the provider, the doctor, the practice to enroll, I guess, in HealthSnap and become a client of HealthSnap.
Right.
And how does that work with the patient? What does the patient need to do, and how's that information valuable to the practice and to the provider?
Right. So coming out this month actually is the integration with wearable devices, particularly Apple Watch and the iHealth in the Apple application. And so we're able to pull that data and run it through our platform and or what we call translating that data. We take that data that's being collected. We're device agnostic, meaning that it doesn't matter where the data is coming from, as long as we have that data. We're able to take all the bits and pieces in various devices and tools and measurement devices and analyze it as one whole picture and give that picture, that profile, what we call lifestyle profile, to the actual patient and the physician. So our goal is to have, for everybody who's looking at this data, to have the same conversation. It's data that was never introduced in healthcare before, like, for example, number of steps per day. What we do, and this is one very small example of what we do, is looking at the steps per day. And, I walk around and I hear people say, oh, I just need 2,000 more steps to get my 10,000. But imagine you're a 5-foot female versus a 6'7" tall male. Your gaits are completely different, and your length in steps are completely different. So 10,000 steps for a taller male versus a shorter female, for example, would not suffice for being sedentary or having all the needs to optimize your wellness, for example.
So it's not a one size fits all kind of thing.
Exactly.
For you, right? It's based on your I guess your age, your size, your weight. So for example, break it down even more, just as an example. This is a hypothetical example. So the 10,000 step scenario on a day, and the male is 6'2" and he's 250 pounds, he may need 10,000 steps, right? Versus the woman who's 5'2" and 120 pounds, she may only need 5. Is that what you're saying?
Yeah. So what we do is we actually personalize the number of steps that you need.
Right.
So we look at all the various factors and all the data that we're collecting. Then that's one output that we give is this is how many steps you need in order to not be sedentary for a person your height, your age, your activity level, for example. So now it's hyper personalized to the individual.
Right. So, and being very, like, say, practical and to understand it from a, like, let's say I'm a 3-year-old, right? So the patient has an Apple Watch, as an example, and they have to download, this is what I know, obviously, about the platform. They have to download, I think, the HealthSnap platform app to the Apple Watch. And then, you know, it begins to capture all the data from your walking and your heart rate, right? You could fill in the blanks, but that's kind of like the way it starts, right?
Yeah, you just download the app on your phone. And normally, right now, what you do is you go to your physician's office, and your physician will invite you to join his network of patients to be connected. And so he'll send out an invite to you. You say yes, and then you download that app and you log in, and you've established a connection with your physician. So the goal is for the physician to have some insights outside of the clinic of what you're doing on a lifestyle base. So when you come back, he can actually see if you're doing everything that you're supposed to combat diabetes or cardiovascular disease. A lot of times the physicians right now are left in the dark, you know, other than did you take your pills or did you walk your 10,000 steps per day? So now we're giving the doctors insight into what the patients are actually doing every day, as opposed to just taking that medicine.
Right. So that again, and so that you have the smart device, the Fitbit. I guess it could be a Fitbit as well, right?
Right.
At one point, yeah. Apple Watch. You have the HealthSnap app downloaded through the invite from the doctor. You're tracking all that data, and then that data gets sent to the doctor in some kind of dashboard, right? They see some kind of report, correct?
Correct.
Okay.
We call it the lifestyle report. For the patients, called lifestyle profile,
Right.
and you're seeing exactly what your doctors are going to see. The difference, what your doctors get to look at is how his population of patients are doing as a whole. So if he has an entire population of patients that's 60% diabetic and that's extremely sedentary, he'll know that those patients are not, or you know, that's the biggest risk right now for his practice, and that's why he's not seeing the results that he's seeing. So that we're giving a lot of insights into even the practice analytics and the caretaking analytics of the patients.
Okay, right. So they look at, let's say, the disease diagnosis. So it could be, let's say, cardiovascular disease, diabetes, obesity, whatever the diagnosis is, and they get this information. They could try to work with the patient to meet some kind of plan to get them healthier and better.
Right.
Okay. That information is separate from the electronic medical record. It's a dashboard the doctor has to log into, correct?
Right.
Okay. And then does the platform make suggestions to the provider of what needs to be done?
The lifestyle profile actually does. And so that's the same insights the patient gets and the same information that the doctor gets. So when you look at our platform, what you see is these are your metrics. This is your results. This is what it means, and this is what you're going to do about it. So the physicians have the ability to actually make comments on what to do about it, to add to those comments, to remove from those comments, and add more suggestions to those to the activity level or the nutrition level for the patients.
Gotcha. And then obviously that helps to come up with a better plan for the patient.
Exactly.
And, to get better and healthier. So now the doctor has this information, and the doctor is spending time, right? The provider more than likely is a doctor. Could be a mid-level provider too, correct? Could be a nurse.
We have dietitians, we have nurse practitioners, physicians, all types of physicians. We even have corporations that's using us in corporate wellness, for example, so employee wellness. So it's what we specifically do very well is translate the information that's being collected from the wearables, and then giving insights into what all of it together means. And then we give that information to your physician, to the patient, and then to any corporate partnerships that we have that needs that information to create insights or resources and services for their customers.
Yeah, one thing that we didn't kind of cover was that about the food, right? About your diet, right? So diet is typically associated with most of the challenges that we have in our health, right? What we eat. So there are apps, right, that consumers can download to their wearable device,
right?
But where they have to like enter I ate 2 donuts, I ate some brown rice, I ate a bagel, so, you're too high in the carbs, you need to kind of, all those kind of things. So that information gets fed into this app, meaning a food app. I think you know what they are. I don't use wearables, but personally, I use a real watch. It's a real watch. I'm sorry. I gotta get a Fitbit.
I have both.
Okay. So, on both hands?
I wear my my Apple Watch when I exercise. I like to measure my activity.
Do you have one on now?
No.
Oh, that's a regular watch.
This is my day-to-day, and then I'm sorry.
I gotcha.
Yeah.
All right, that's good.
You a fitness tractor when I actually.
You won me over because you're wearing an analog watch. And people say Apple Watch is a watch. I go, nah, I don't know about that. So you have to move pieces, got to have second hands and mechanical. But anyway, so that food stuff needs to be entered into an app, and that also could be transferred over, right? Like how many calories you're eating every day, all that kind of stuff to the doctor, right?
Yeah, we love it when patients are actually using these apps, third-party apps, because it makes it easier for us to translate that information without them having to go into ours or another one. So they're disciplined, and they actually use like MyFitnessPal or some type of nutrition app that's recording their calories, their intake, caloric intake, their nutritional intake. Yeah. We just sync with that, and that removes the friction of actually having to enter data in multiple applications. Just entering it into the one that you really like the engagement platform for, and then we get that data, we translate it, and we tell you what that all means together.
So it doesn't matter which app; it could be any app that's on some kind of wearable device, right?
Right.
iOS and Android.
Yeah, it doesn't necessarily have to be a wearable device. For example, it can be an app on your iPhone or your Android phone or your Samsung phone. Mm-hmm. And if you're utilizing it, engaging in it, and you're putting that data in, we can tap into it with your allowance and translate that information alongside all the activity levels that that's being tracked from your wearables. And even with for example, you have your iPhone, you don't even need a wearable because your iPhone's tracking every time you make steps as well. So there's a lot of insight into what's being collected, and we've analyzed these pieces of devices that's collecting data and say, okay, a lot of people don't even realize that this type of data is being collected every time they make a movement or every time they sleep and whatnot, and we're able to gather that insight. Our goal is to remove any friction from being able to translate that data.
Yeah, and one of the things I'm sure you're aware of in the healthcare space, we get these reports regularly that doctors are having a high sense of EMR burnout.
Oh yeah.
They are overwhelmed with these multiple screens and drop downs and tracking data and all this kind of stuff. And I know that's a challenge for some of the providers. So I think we had chatted about, is there a financial incentive, right, for the practice? Apart from doing the right thing, we want the patients to get well, we want them to live long life, good quality of life, right? Is there some kind of a mechanism for reimbursement for them reviewing a report? And talk about that a little bit.
Right. So there's two ways in the digital health industry right now of billing insurance, or it's through Medicare specifically right now. There's chronic care management. So if there's a specific chronic disease state that the patient's in and they qualify, then physicians can build a program on a platform to manage their health and be reimbursed by Medicare for it. The other is what we call remote patient monitoring capabilities. And so just this January, they released what we call unbundling of these CPT codes, where they actually can build specific individual CPT codes as opposed to just one that covered a bunch of different things that you have to do in order to get that one done, that one CPT code covered. So we think that this is an inflection point in the digital health industry where there'll be a shift in private payers looking at this information differently. I actually put out a blog from the CDS conference regarding Cigna's comment on the digital health industry and their direction on coverage that they'll be taking with wearables and digital information. So that it's a really great read on what Cigna is doing. And so looking at the private payers, they're moving in that direction as well. So if the doctor is looking at digital health data, this is one example of a CPT code, a procedure code that can be built. If they're looking at this data for about 20 minutes per month per individual, and it doesn't have to be the doctor specifically, it can be a medical assistant, what we call a qualified individual within the practice, looks at this data, verifies the data for about 20 minutes a month. The doctor can bill about $40 to $60 per patient per month. So the goal is to have these patients be on a more preventative plan where the patient doesn't need to come into the office. The doctor has insights on the patient, and then the preventative aspect of it is that he's alerted or he's aware of the trends that's happening with these individuals. And that's one thing that we have on our platform is trends, where doctors can start seeing Jane Smith and she's starting to trend her and she's moving into a direction of diabetes, or she's pre-diabetic, for example. So that's giving doctors insight and then taking action before any of this, before they either go very far into a chronic disease state, or they fall into a chronic disease state. So insurance, once Medicare allows it, the rest of the industry starts following.
Oh, that was excellent, Yenvy. Thanks for that,
No
clarifying some of that stuff. I think that where we start, right, we get the providers to begin to use, let's say, these types of, platforms like your platform. They got an incentive, obviously, to use it because they're going to be able to bill for it. Right. And eventually, hopefully, I know that Medicare is the largest insurer, largest biller, right? You got to start there, and then the other insurance companies may go along and start allowing, right, for billables for this kind of service. So that's good. And then eventually it'll start going back into, the actual insurance premiums. Now, we're not talking like in a year or two. We're talking probably a couple of years.
Right.
Where the providers can bill, different insurance companies will start allowing that to bill, and then they start to inquire to the patient, are you wearing wearable devices, for your health? And hopefully they say yes, and that decreases their insurance premiums on their employer-sponsored plan, right? Health and wellness things. It kind of goes back that it becomes a method to decrease insurance costs, right, for the patient, reward those who are eating right, exercising, that kind of thing, kind of like you running half marathons and marathons and stuff. It's amazing. I run, but I'm not like that.
I'm not a good runner. I just run.
I just run. Yeah, so you get rewarded for that in your premium, right? Just like you're a safe driver, right? You don't have accidents, and we'll give you a lower insurance. So it takes. Go ahead.
That's actually what we're doing at the University of Miami with their wellness programs. With their employee wellness program is they use our platform to measure a baseline of their employees And then every quarter they actually get reevaluated on our platform. And if there are metrics that we've set, where if those metrics actually go down, they save about $1,500 on anywhere from $350 to $1,500 there on their insurance.
The employee or the
employee.
The employee, so the employee sees the benefit.
The employee sees the benefit.
Oh, that's great.
Because that's prevention. And you know, what I've learned, I have a friend that works in one of the private payers insurance and companies, and what I've learned is, for example, type 2 diabetes is so costly to the industry and to the economy, versus a patient who actually has cardiovascular disease and had heart surgery, because the medication to sustain a person with type 2 diabetes is extremely expensive and costly, and therefore just to sustain individuals, it becomes a burden on the healthcare system.
Yeah, so I mean, now we're talking probably years out, where it becomes to penetrate the insurance market, right? And the employer market. But you got to start obviously at the point of care, which is the provider, right? And then kind of work backwards. And then to get the provider to do it, you got to pay him. So it's kind of
some kind of incentive, yeah.
Well, you know, they're already doing other stuff, right? Like we talked about burnout. And, I got one more thing to do. Oh, we're going to pay you $50, $60. Okay. Again, at least I'll get reimbursed something for my time to review these reports. So, got.
And we really look forward to this direction in healthcare on the prevention side, because we feel that if a physician is your partner in healthcare, as opposed to just the person that you go to when you're sick, you're always at an optimal level, and he's always finding ways to make you even better. And I feel that that's how physicians should be, as a partner, to always make you feel at your best. And so now with this shift in healthcare, where now the doctor is able to monitor and prevent, he has the ability to eventually put the patient into a program that is always preventing that patient. And at some point, that shift, that becomes some type of subscription model of some type, where now the patients, they're paying $50, the insurance is paying $50 to maintain an optimal patient, and the doctor has a very strong stream of revenue in his practice, as opposed to only seeing sick patients, and then not knowing when these patients are going to be only when maybe they only come in once a year or something like that, when they have the cold or flu, or when they actually have a disease, for example. And so now he's able to really manage his practice, the business side of his practice as well, and I think when you go into concierge and direct primary care, that's a lot of the revenue models that's starting to play into it, is understanding the business a little bit more, and then really optimizing the individual's wellness.
That monthly revenue model, where you're giving somebody, the doctor, a practice of 1,500 patients, an extra $50 per patient. It's like a capitated HMO kind of setup, rewarding them for keeping these patients healthy, which is where we are moving as a healthcare system, where they want to reimburse providers who keep the patients out of the ER. Keep them out of the office, because that's where now we're paying for results, not fee for service, right? Every time you go in, and it's like an ocean liner. You're trying to turn this thing on the dime. It's taking a while to get there, where we're reimbursing for outcomes, not fee for service care. So this kind of goes in line with that reimbursement, rewarding the patients, because if they're healthier, we're not seeing you in the practice, right? We're not. So I'm getting extra money just because you ain't there, which is good. That's a good, right? That's good. Assuming that there's an incentive to keep you healthy, right? Versus come in, I want to see you 5 times a year and bill, $85 a visit plus blood work plus scripts and stuff like that. So what is your if you have any recommendations on the types of devices that people wear? Do you like, the iOS or the Android? Do you like the Fitbits and the Apple Watches? Like, what do you like? Do you like, certain apps? Like, what do you, and again, this is your opinion, okay? Not everybody can do whatever they want, but like, you're running stuff. When you said you're running a marathon, I'm like, okay. So tell me what you like to do besides me eating bagels and donuts.
I think I run because I like to eat. That's the.
Oh, you want to eat and burn it off. You want to burn it off. I got it. Okay. So what kind of devices do you like, and what do you just based on your experience?
Honestly, I'm not biased to any device. I like them all. Just the fact that it's giving some insights to an individual. It all depends on the person and what they're looking for.
Mm-hmm.
For me, I'm an Apple Watch person. I just like the design of it, the look and the feel of it. That's just my take on it. But as it relates to how it's collecting and what it's collecting, I think it's fairly similar across the board.
Okay.
And with what we do is we normalize that information and we create a baseline. So if you have a Fitbit or an Apple Watch, that information is being normalized either way. And then we're looking at trends. So if you're going to start somewhere and you're going to go somewhere, and that's what we're looking at.
No, that's great. That's great. Yeah, and again, everybody has their own devices and what they like and what they recommend. And again, the Apple products, just because I'm not an Apple person, I'm an Android person, but the Apple products, yeah, it's okay. They really integrate into a lot of stuff. The integration into many different services and platforms and software is just, and Android has their integrations as well, but a lot of people say they like the Apple because of all this smooth integration into so many different products, which is good, and that's how Apple keeps you captive, right? That's kind of like the way it works. But that's good. So tell us enough about HealthSnap now. I think we covered that good. Tell us, what do you like to do when you're not doing HealthSnap and you're not running because you feel like running? Tell what do you like to do to decompress and off time, and tell us about that.
I surf and I rock climb as well. So that's something that
is there rock climbing in Miami?
Well, rock climbing gyms, not really mountains. I don't climb mountains. I rock climbing gyms.
Surfing again. Right. Yeah. That's, you're in Miami.
Kind of in Miami too. I used to live in California. We had all of that, and that was really great. But the warm water in Florida is great as well.
Well, of course.
Yeah.
So you like the rock climbing and the surfing when you're not obviously exercising and that kind of thing. Any movies? Are you into riding the bike? Are you any arts?
I read a lot. I'm one of those individuals that probably read the 100 books a year type deal.
Wow.
Wow. So there's always some type of I read it on every type of device and physical books, and also I'll have depending on what I'm looking for in the book, it will be an audio book, Apple book or whatever, a digital book, or just an actual physical book. So it depends. So I always have a book I'm reading, probably anywhere from 3 to 4 books at a time.
Oh, wow. So yes, you're one of those people that, that try to read, easily more than one book a month. Just
oh yeah.
Is it all type of stuff? Is it nonfiction? Is it business related? Is it science fiction? You want to get lost in reality, non-reality based,
Yeah, I like it. So I'm more of a nonfiction individual. So it's a lot of investment books, management, leadership. I've really got into growth, spiritual books, so it's just, it depends if I'm reading an autobiography, and that person talks about a book that changed his life. I'll probably go and read that book because I want to see what he was talking about. And then I go down this rabbit hole of this stream of books that everybody recommends some type of reading in a book. And so,
Good for you. And that's great. That's a lot of reading, which means that you're probably not digesting. I know you're doing audiobooks and all that and paper, but you're probably not digesting a lot of other, what I say, movies and stuff like that, because you're really reading a lot. So and listening a lot. So it's that's very interesting. Because again, if you're an exercise person running in the gym, people have their podcast on, they have their listening to some kind of educational thing, and I always wonder about this kind of stuff. Like you're reading all these books, and I've read a lot of books, obviously, and I don't read as clearly as much as you. But you wonder, do you remember all this stuff, right? But then it comes out later.
Yeah,
You're talking
exactly.
to somebody, and it's like somewhere in the back of your head, it comes out, right? Okay.
Exactly. I love it.
I can't remember what book I read this in, but I know that
Exactly.
it just sounds good.
Yeah,
Okay,
exactly.
so we're gonna, yeah, thank you for sharing. We're gonna go through our lightning round of questions right now, more about other like stuff you may like. Okay,
Okay.
so all you gotta do is give a response to the question. All right. So coffee, hot or cold?
Hot.
Hot coffee. Your favorite food?
French fries.
Oh, what? From where?
Oh, BurgerFi, I would say.
Okay, BurgerFi. All right,
Yeah.
all right. That's interesting. Hot dogs.
Hot dogs? Yes
Yeah,
or no?
yeah.
Yes.
Mustard or ketchup?
Mustard.
Okay, good. Traditionalist. Burgers, ketchup or plain?
Ketchup.
All right, traditionalist. Pizza.
Yes.
Uh, I need those carbs. Apple or Android?
Apple.
You already answered that question. I seeded you earlier. PC or Mac?
Mac.
Laptop or desktop?
Laptop.
Okay. If you can go anywhere on vacation right now and money and time was not an issue, where would you go?
I just came back from Paris, so that's what I did.
Takedown. Good for you. Good for
Yeah.
you. Hot weather or cold?
Oh, that's a hard one. Warm. Okay, cold. Hot. I don't know. That's so
Yeah,
hard. I'm happy either way.
did you say surfing? You like surfing? That's hot, obviously. Weather. You got to have hot weather for that. Rock climbing is indoors, the way you do there, so that's kind of AC.
I'm happy either way. I can live with both.
I
But
got
probably, I would probably say just hot because I grew up in Florida. So
I got you. I got you. Okay. And wristwatch, you already said yes because you're wearing one, right?
right.
Okay. For books, Kindle, paperback, hardcover.
All of it.
Oh,
Yeah.
okay. And podcast. When do you listen to a podcast?
When I drive, occasionally I'll listen to a couple of different podcasts.
Okay. New car or used?
New.
Okay. Dogs, cat, neither.
Dogs.
Dog. Goldfish?
No goldfish.
So when you do see a movie, when you're not reading 100 books, when you do see a movie, is it streaming or is it in theaters?
Streaming.
All right, so you're going to do that Hulu, Netflix kind of thing
Right.
versus going in to be around people, right?
I don't mind being around people. It's,
I know.
I think I fall asleep in dark rooms.
Turn the lights off, I'm going to fall asleep.
Exactly.
No, I got you. Well, it's been great. We've been interviewing the CEO and co-founder of HealthSnap, and it's Yenvy Truong. It's been a great pleasure chatting with you and learning about HealthSnap. Thank you for sharing your insight. And we wish you well with the business, and it sounds like it's going well, and you're right at the cusp of what's happening in the transformation in healthcare with wearables and devices and all that kind of stuff. Best of luck with the business.
Thank you very much.
You're welcome.
Thank you for your time. Have a good day.
Enjoyed it.
Bye-bye.
Bye.